News headlines at 7:30, a full bulletin at 8 o'clock. Now, following a recent attack on an ambulance in Cape Town last week, Emergency Services Union HOSPERSA is considering withdrawing their members. And the Health and Other Services Personnel Trade Union of South Africa says if the Department of Health doesn't intervene, they will be forced to halt their services. Now, attacks on paramedic staff have become a common occurrence, with patients also being severely compromised. To discuss this further, we're joined by Kevin Halama, National Spokesperson of the union, as well as Dr Shaheem de Vries, Head of the Emergency Medical Services in the Western Cape. They're joining us from our Cape Town studio, and Kevin is here with us. Thank you very much indeed for your time. Kevin, maybe let me just start with you. Tell us about the safety plan that is being proposed. Are you for it?
To be honest with you, from a labour's point of view, we haven't been consulted regarding the safety plan that was announced on Friday. So this morning, our provincial leadership in the Western Cape will be trying to get more details from the Health MEC in the Western Cape. From our side, we feel that any safety plans that are put in place by government or any state officials, the labour needs to be consulted, because I mean we have members that are directly affected by these attacks. So at this point in time, we feel that it's too early to comment on these safety plans because we haven't been consulted.
Give us the extent of these attacks. How many patients have been mistreated or suffered, or even families lost their loved ones by such attacks?
In terms of the incident that took place last week, when an 8-year-old boy passed away because he was deprived of urgent medical assistance as a result of the robbery, that was the first fatality that we've come across. In the past, I know that last year there's been 100 incidents that were reported within the Western Cape itself, and that prompted us to even have a march through the Cape Flats in Philippi, just to beg communities to stop these attacks. This year, it seems the situation has calmed down a bit. However, with the festive season approaching, we are going to experience more of these attacks as more of our members are being called to the scene. So we can't really pinpoint as to how the members are being affected, but I mean, if 100 incidents were reported last year, chances are there have been a number of patients that have been deprived of urgent medical assistance.
Dr Shaheem de Vries in Cape Town, what's your view on the safety plan?
Morning, Blaine, and morning to Kevin. Well, from the outset, I must say we've consulted with Labour extensively. In fact, the plan was put together as part of our engagement with the Safety Committee within the Western Cape. Because of the importance of this challenge to our service, the Minister commissioned a task team that looks exclusively at the safety of paramedics and EMS workers within the Western Cape. And as a consequence of that, we've managed to come up with several initiatives that we hope would address some of the challenges that our staff are facing.
You know, Doctor, we've seen these pictures on our television screens of grieving parents losing an 8-year-old son just recently. He was being transported to a hospital. When you see such visuals, what does that do to you personally as a medical professional?
Well, I think the tragedy of what happened to the Wilshire family hits everyone quite hard. I think what it illustrates is the impact of violence and injury on our society. And it's as a result of that we've come up with the plan. I think, if I may refer specifically to some of the initiatives that the Labour has put on the table, it's because of that, to avoid such scenes of tragedy, that we need to make sure that our services continue. And for that, I must commend both Labour and the staff who have, despite the very real challenges that face them, have continued to come to work and have worked with us in attempting to deliver services to the most vulnerable in our communities.
Kevin, I understand that you have, the unions have written a letter to the Health Minister, Aaron Motsoaledi. Have you received any response yet?
At the moment, we've only received acknowledgement that the letter was received, but we haven't received any a formal response specifically addressing some of the concerns that we have put on that letter. We are probably expecting a response from the minister this week, hopefully. But as history would tell, is that in the past, we've written similar letters, and the minister hasn't been forthcoming with maybe formalizing some sort of a national task team to look into these attacks. But we are encouraged by the safety plans that have been put in place. Probably what the doctor is talking about in terms of our role in these plans, that we've constantly been calling out for more to be done towards curbing these attacks. So probably some of that consultation that he's talking about is probably the letters and the countless calls that we've been making on media and especially on the ground, that a government needs to do more to stop these attacks.
You know, for many paramedics, it's a vocation, isn't it? It's probably a tough call and a tough decision to make to say we're halting services. Because the paramedic's job is to save lives, and that's what they do. Are you willing to compromise? Is there any middle ground for you?
To be honest with you, halting service is not the best interest of everyone involved, because that would mean that the communities will be deprived of urgent medical assistance. It is really a last straw. Our members are really frustrated. They've made, like I'm saying, we've made numerous attempts to engage government to improve their safety, and our members, it's more of they're being frustrated that they're seeing that nothing is being done. But we managed to calm the nerves down on the ground. And on Friday, when the MEC announced these new safety plans, we still need to engage with all our members to hear their views on these safety plans. Yeah. But to be honest with you, it's not the best interest of everyone to halt services, and we'll try by all means to avoid that. Hence, we are writing these letters to the minister and coming up with proposals to ensure that services are not being halted. Yeah,
Dr. de Vries, I'm sure you'll concur with Kevin. It's not in the best interest of anyone to halt these services. But what sort of interventions are you looking for to government in order to put pay to this problem?
Thanks, Blaine. I just want to commend Labour for its view in terms of illustrating the gravity of a decision to withdraw services. And I think that's one of the successes we have had through our engagement with Labour and through the political leadership, both of the city and of the province. We've managed to set up an interdisciplinary, multi-agency plan that looks at creating a network of safety, in particular looking at better cooperation between the city, the province, and our safety stakeholders, such as the SAPS and Metro Police. But what I've been particularly encouraging is civil society. So our engagement with the neighborhood watches and community policing forums and the health forums have really paved the way for stronger relationships. I think we need to realize that this is a societal problem. It is not something that's specifically targeted at emergency workers. And as such, it requires a multi-pronged, a whole-of-society approach. And I, for one, am incredibly encouraged by the leadership shown both within civil society and within our Labour caucus to try and address this.
Okay, that's where we'll have to leave it. That was Dr. Shaheem de Vries, head of the Emergency Medical Service in the Western Cape, as well as Kevin Halama, the union spokesperson. Thank you very much indeed, gentlemen, for joining us. It's 7:40 now. Let's take a bit of a break. Morning Live will continue after this. Stay with us.